everybody. My name is Meredith Smith, and this is the PowerPoint presentation for my PICO question for HSC 852 Evidence-Based Capstone. This is my English Bulldog, Maddie, and she will be guiding this presentation with a Bulldog theme. My PICO question is, do millennials prefer esoteric acupuncture treatment compared to premillennials? The population being studied in this question is the millennial generation. The intervention for this study is esoteric acupuncture. The comparison for this study is the millennial generation versus premillennial generations. And the outcome of this study is to determine if millennials prefer esoteric acupuncture compared to premillennial generations. So the question is, what is the rationale behind this PICO question, and why do we want to study it? Why is it important to people today? So to start off, a little bit about the millennial generation. When we're talking about them, we're referring to people born 1981 or after 1981. When we're talking about the premillennial generations, I am referring to anybody that was born prior to 1981. And it's really important to talk about millennials today because they are the largest generation in the United States. And they make up approximately 75 million Americans, 30% of the American voting population, and about 2/5 of the workforce today. The new healthcare paradigm and why millennials are reshaping it is actually one of my first topics for literature review. And the reason that this is important is because of the previously stated up-and-coming generations and why it's so important to pay attention to this generation because they make up such a large part of the population. So a couple of different factors that millennials consider when they're talking about healthcare or dealing with the new healthcare paradigm is the cost factor, the trust factor, and the technology factor. So all three of these factors are kind of like concerns and also topics of interest for the millennial generations. So the cost factor simply refers to the high cost of healthcare and the high cost of health insurance. And that also includes being able to afford private healthcare insurance or, just receiving any government-based health insurance or having any kind of healthcare coverage. The trust factor refers to lack of trust in the healthcare system. And this includes, physicians, other healthcare providers, and even technological factors, which we're going to get into next. The way things are done, the way lab testing is conducted, how patients are scheduled, how billing is done through technology, connective devices, and really all kinds of things, costly and none. So there are positive and negative aspects to the technology factor, but these are three of the main concerns that millennials have regarding healthcare in general. So some other factors we need to consider here with the millennial generation are that many of them feel Western models don't help. Meaning that a diagnosis for a condition may be inaccurate or they may be prescribed a medication that doesn't work or that they have an adverse or allergic reaction to. For example, somebody who needs an antibiotic might take amoxicillin and then find out that they're allergic to it, so they have kind of a negative experience with just taking medications in general after that. Another example would be the root causes are not addressed. So let's say a patient has anxiety or depression and they are prescribed a medication to treat that, which maybe helps, but it doesn't cure the condition. And so millennials are more interested in connecting to the root of what might be causing a condition to happen and fixing that rather than being on medications for long periods of time, if at all. And so, as a result, many prefer alternative treatment methods such as acupuncture due to these factors, and a lot actually prefer preventative care and wellness over drugs and medications in a lot of different circumstances. So some topics for literature review regarding this PICO question include the new healthcare paradigm and how millennials view healthcare versus the premillennial generations, esoteric acupuncture, which is our intervention, and identified methods, so subtopics of that, and the types of treatments that esoteric acupuncture defines. Millennials who are born after 1981 and how they perceive esoteric acupuncture, and also how they experience esoteric acupuncture treatments. Premillennials are those who are born prior to 1981 and how they perceive and experience esoteric acupuncture. And preventative care versus treatment of existing conditions. And we're going to get into this a little bit later on when we define esoteric acupuncture. So, Maddie wants to know, what is esoteric acupuncture? That's the big question, and also one of the main topics for literature review. So, esoteric acupuncture is a new form of acupuncture that was defined and coined, I guess titled, you would say, by Dr. Mikio Sankei in the 1990s. And he actually explains in his books how this title came about, but he has about 7 or 8 books now. And this type of treatment really has to do with harmonizing and strengthening the body's systems before a disease forms. So it's a new form of acupuncture which combines multiple systems of energy medicine, including Ayurvedic medicine and chakras. So essentially what he describes is that the acupuncture meridians are like, they're pathways, they're channels of where energy can be passed from along a specific trajectory to basically to treat a certain condition on one of the bodies. And the chakras they're bigger energy centers. So there are 7 main ones, depending on how you look at it. There are actually different ways of looking at chakras. In some systems there are 12, in some systems there are 13, but for the purposes of esoteric acupuncture, we're looking at the main 7. And this modality focuses on cultivating wellness rather than working with disease. So the main difference between traditional acupuncture and esoteric acupuncture is that traditional acupuncture is very good at treating conditions that have already manifested, signs and symptoms of depression, of arthritis, of pain, of infertility, any kind of disorders that have manifested as signs and symptoms is very treatable with traditional acupuncture, and that's TCM acupuncture. Esoteric acupuncture focuses more on the subtle bodies and balancing those subtle bodies before a disharmony forms. So it's very preventative. Okay, so the question is, why might millennials prefer esoteric acupuncture? So millennials prefer esoteric acupuncture in my clinical experience for a number of reasons, and mainly it's because their level of consciousness is more concerned with preventative care, wellness, and kind of the spiritual side of it. So when we look at the subtle bodies, The subtle bodies are essentially different layers of your electromagnetic field that contain the physical body, the emotional body, the mental body, the spiritual body, and the etheric bodies. And it is noteworthy to say that the acupuncture meridians are actually located on the etheric body, which is the next layer out from your physical body. So this is some of the stuff that I'm going to be explaining in the literature review part of this project as well. But basically, what it aims to do is esoteric acupuncture aims to stop an illness in one of these subtle bodies before it manifests on the physical or emotional bodies. So it's basically about preventative care and maintaining harmony and balance before you start to feel any symptoms. And esoteric acupuncture is very, very good for this. One of the reasons that millennials may prefer esoteric styles is because of their fear of Western medicine, or they've had a bad experience in Western medicine where they took a medication that did not agree with them, or it could just be that they want to avoid taking medication and avoid interventions such as surgery altogether. So this seems to be sort of like a level of consciousness that a lot of millennials are embracing at the moment. Pre-millennials, it's a little bit different, and I'm not saying that pre-millennials do not enjoy esoteric acupuncture. It's just that generationally, they prefer treatment styles that treat the symptoms that have already manifested, such as fatigue, pain, depression, arthritis, anything else that might be manifesting on the physical body. Insomnia is a big one as well. And traditional acupuncture focuses a little bit more on what's going on in the physical body and how to balance out or alleviate a symptom that has already started to occur and can already be felt by the patient. The reasons for this is speculation here, but I'm going to look into this more in the literature review, is that maybe it's a different level of consciousness. Maybe the millennial generation looks at things from a more spiritual perspective, or possibly just different physical ages. Millennials in general are younger and simply might have had less time to allow an imbalance to manifest, whereas the pre-millennials are a little bit older and they've been around a while, and so things that are happening in their bodies are chronic and a little bit more difficult to treat in a preventative way. So some subtopics of esoteric acupuncture include Ayurvedic medicine and the chakras, which we previously discussed, traditional Chinese medicine and the classics, sacred geometry. Sacred geometry is a very big topic right now in the metaphysical world, but as well, its relationship to esoteric acupuncture has to do with point prescriptions and geometric ways of activating specific acupuncture points. So in other words, it's, you needle one point on one side, one point on another side, et cetera, in a specific order. The next topic is the electromagnetic field and the subtle bodies, which we talked about. The electromagnetic field is sometimes called your aura, and it contains the subtle bodies, the mental, the physical, emotional, spiritual, and etheric bodies, which are treated very efficiently with both types of acupuncture, traditional and esoteric. Crystal therapy is actually very interesting because a lot of people do not regard crystal therapy as being a valid medical modality. And so essentially what crystal therapy is using minerals with different properties. Different minerals, different metals even, are all on the periodic table, and they all have different atomic numbers and different atomic weights, and they essentially treat the physical body, the emotional body, the mental body, the spiritual body through the conduction of energy in specific pathways. And crystal therapy is actually extremely effective in pediatric patients who cannot be needled, and also in therapies such as shakuju therapy, which is an example of a non-insertive acupuncture treatment style. And lastly, Western astrology and TCM. So this is a very interesting topic because the classical texts actually talk about your birth chart and the position of the celestial bodies as having an influence on your health. And esoteric acupuncture does get into this a little bit. So your astrological sign or element might have it might have something to do with the types of imbalances that a person may develop in their lifetime. For example, somebody born under the sign of Taurus is associated with the earth element. And the earth element meridians are the spleen and stomach meridians in acupuncture. So we can expect that a person who is born of the earth element is vulnerable in these areas. They may be stronger or more vulnerable, but things that we could expect are digestive issues, IBS, constipation, and other things related to the spleen and stomach meridians. So this is actually a very interesting topic as well, and one that's considered in esoteric acupuncture. So in this presentation, I've included a short video by Dr. Mikio Sankei about esoteric acupuncture. So if you're interested in this topic, this is an excellent video to watch. And last but not least, the references page. Here are a couple of references that I used to create this PowerPoint and will be using in the literature review as well in APA format. And I really hope that you enjoyed this PowerPoint presentation, and I look forward to all your comments and questions and our upcoming discussions. Thank you so much. Okay.